What determines aging? What are the most effective methods to prevent skin photoaging? What does the future hold? Welcome to the EDV podcast. In today's episode, Professor Chris Griffiths and Professor Johannes Ring explore the mechanisms that underlie aging and discuss the first signs and manifestations. They delve into various factors contributing to skin aging, including genes, healthcare, and the environment. The discussion also covers preventive measures, such as using sun cream, practicing calorie restriction, and intermittent fasting to help delay aging. Tune in to gain valuable insights on how to maintain a healthy and youthful-looking skin. But before we dive into this topic,
get ready to experience cutting-edge science and innovation in dermatology and venereology at the upcoming E90 Congress in Berlin from the 11th to the 14th of October 2023. The Congress is one of the largest international gatherings dedicated to dermatology and venereology, providing a platform for the brightest minds in research, clinicians, and top industry professionals to come together, make connections, and foster scientific collaboration. The diverse interactive program covering the full A to Z of hot topics also includes innovative hands-on workshops, subspecialty sessions, and industry sessions. The exhibition hall will provide opportunities for delegates to explore the latest technologies, treatments, and products in the field to date. The wait is over. Tickets to attend the Congress on-site in Berlin are on sale now. Be sure to check out edvcongress2023.org for more information.
Professor Chris Griffiths is a highly respected dermatologist who received his training in London and Michigan. He is currently the Chief of Dermatology Department at the University of Manchester and has served as a board member or president of various organizations, including the British Association ESDR EDF International. Professor Griffiths is the editor of the British Bible of Dermatology and Brooks textbook. And now the floor goes to the professors.
Hello, everybody. Welcome to this EADV podcast on biology of skin aging and beyond. What can we do? Can we prevent it? And we have an expert here, Professor Chris Griffiths. He was until recently chief at the Dermatology department at the University of Manchester. He got his training in London, in Michigan, in the United States. And since 2005, he's in Manchester. He has been active in many societies, board member or president of British Association, ESDR, EDF, International League of Dermatological Societies. He also did humanitarian activities in a Syrian refugee camp and in Bangladesh. He is editor of the British Bible in Dermatology, Rook's textbook, got many awards and honorary lectures. Hirsch Index 112, the third most cited dermatologist in the world. And his research focuses psoriasis and aging. And we are very happy, Chris, that you devote this time to this activity. And now I would like to ask you, what brought you to study aging?
Well, thank you, Johannes. First of all, just say it's a real pleasure to share this conversation with you. And I guess that a lot of people know me from my work on psoriasis, but my research on aging began when I was a junior faculty member at the University of Michigan, working with John Voorhees. And like a lot of things in life, it's being in the right place at the right time. And at that time in Michigan, as you may know, they were taking forward the use of topical retinoids, tretinoin, for the management of photoaging. And of course, the results were quite remarkable. And I got involved there with working on the sort of understanding the mechanisms that underlay both photoaging and also the effects of topical retinoids. And when I moved back to the UK from Michigan all those years ago, I felt that one of my key areas of research should be to take forward further understanding of photoaging and now increasingly intrinsic aging or chronological aging.
Well, so we are happy to have you here. And I think we should start with aging in general. Everybody talks about the demographics. The people grow older and older, but this is populations. Is there also a change in the individual lifespan? How old can a human being become?
Well, yeah, there's two questions there, really. I mean, one is that, the population of the world being 8 billion at the moment, is estimated that about a billion people are over the age of 60. Now, of course, both you and I would like aging to be defined at a much higher level than 60, but that's what we're stuck with. But in the developed world, about 25% of the people in the developed world are over the age of 60. So there's a population global problem there. And that's in part because we're living longer, because of better healthcare, better public health, particularly. A lot of diseases have been eradicated. Diets are better as a general rule. And over the last 100 years, the longevity of the individuals is improved. But there's still a disparity between the developed world and the and lower middle income countries as far as longevity is concerned. But the longest recorded, the sort of longest lived individual was a woman from France who died at the age of 122. And as a general rule, women do have a longer lifespan than men.
Well, I read an article by a geneticist who told that this difference between men and women of about maybe 7 or 8 years in total lifespan disappears when you start with 70. So when men have reached the age of 70, they have the same lifespan. And he concluded that's the testosterone. When the testosterone is gone, this makes you live a bit longer. But what do you say to this hypothesis?
Well, that's partly true. Of course, men tend to have a higher rate of death from accidents, of course, and so that feeds into it. But I think if you get to the age of 70, your chances of getting to over the age of 90 are significantly increased. And I think nonagenarians, people over the age of 90, are fairly common nowadays. People can expect in the developed world to get to high 80s, 90 nowadays. But I guess what we're going to talk about is not how long you live, it's having that, how long you have a healthy life.
I think that's a very good point you are making. And in order to understand or do something, we should know the mechanism. So what is what are the most important factors in the aging process?
Well, I think if you think of the aging process as being similar to health in general, I think genes play a big role, of course, but and we can't do much about that. But there is good evidence that if one or both of your parents have lived to over the age of 90, you have a very good chance of doing so as well. So genes play an important role. Second is healthcare does play a role, as we've just mentioned. But thirdly, and I think this is probably the area that we can make the biggest difference, is around environment and what people can do to help themselves. So that's everything from diet to exercise and other things that we'll discuss. So there are a lot of factors in play here, both endogenous and exogenous.
Among the environmental influences, of course, we dermatologists always stress the effect of the sun and UV light. And are there any news in this respect?
Well, I guess, if you think of, so there's extrinsic aging and there's intrinsic aging, and the latter, intrinsic aging, or the aging that occurs due to the passage of time, is we're all that's happening to all of us. It's happening to us as we speak to each other right now. And but there are other factors which are exogenous, which affect the skin, which make it look older. And of course, the one as you've just highlighted is sun exposure. No doubt that people who've had a lot of sun exposure have more wrinkles, have actinic lentigines, which sometimes people call age spots. People who smoke, people who are exposed to pollution, other factors do cause premature appearances of aging. But of course, what we're interested in is, is just trying to differentiate between the appearance, which of course is what dermatologists get asked about all the time. And there's a huge industry in aesthetics and cosmetics. But what we're interested in is the mechanisms that underlie aging itself. And I think the skin is a great model to be able to study that.
So when does this aging process really start? Or the immunologist always used to say the thymus gland starts to become atrophic at 17 years of age already. So when do we find the first signs of aging in the skin?
Well, it's actually quite hard to find the effects of the manifestations of aging in the skin until one gets really quite old. The skin is remarkably resilient, in fact, but I think that if you're looking at the changes in the immune function of the skin, and we know that from looking at Langerhans cell function, for instance, that starts to decline after the age of 60.
Yes, okay.
But so I think it's 60 when things, and that's, of course, there's obviously a strong hormonal drive to skin physiology. So, for men and for women. So there's the menopause, which, of course, it affects, obviously in women, and men, it's a slower taper down, but it's still the loss of testosterone. And of course, there are other hormones which have effects on skin physiology.
Everybody talks about the role of telomeres. Is this still an attractive thought, telomere shortening?
Yeah, that's still a viable hypothesis, is that telomere shortening, so effects on telomerase. So people with shortened telomeres have, that's a manifestation of a shorter lifespan. And certainly there are factors such as stress. For instance, there's been some nice studies showing that stress and stressful life events can shorten life, probably because it's affecting telomeres.
Inflammation seems to be a very critical factor, and I think, was it you or I heard it from you first time, inflammaging, this word?
Well, actually, the term inflammaging was actually first coined by an Italian scientist called Franceschi, and he published this in the Annals of New York Academy of Sciences about 20 something years ago. And that he wasn't looking necessarily at the skin, but he made the comment that aging in many organs seems to have a confluence of inflammation of various kinds. And so he coined this term inflammaging, which I think is highly relevant to the skin. I think we do know that in the skin and other organs, there is evidence histologically and through immune function of an inflammatory events in the skin. So, there's an increased numbers of particularly T cells of the Th2 classification, so a Th2 driven response. And also there's an increased number of mast cells and the association of mast cells and macrophages. So there's quite a lot going on in the skin as a consequence, associated, shall we say, with aging. The key question, like in a lot of science, is what is, which is driving which? Is it the inflammation that's making the aging progress faster, or is it just a consequence of aging? And I think there's some interesting research that could be applied to that using medicines that we already are familiar with in management of inflammatory skin disease.
You mentioned the difference between extrinsic and intrinsic aging. So just the factor time. What happens by this? What does time do without sun?
Well, time is no friend of ours, really. I think that there's this constant repair and renewal process, and with time, that matching of the repair to the repair and renewal to the damage starts to be a mismatch. So you start to produce or start to have various abnormalities in skin structure, in the structure of other organs, which means that it's not functioning as efficiently as it was when you were maybe 20 years old.
Well, this is this remarkable phenomenon which we like to show to our students when we discuss this. How can you evaluate? Simple, ask the person to lift the arm, and under the axilla you will see the time effect where the sun is not really coming to. And another thing, we recently had Christian Posch published in our journal, this 92-year-old lady who applied the sun cream to her face. She was told to apply it to the face, but she only applied it to the face and not to the neck. And so the lot of photoaging was to be seen on the neck, but the facial skin was nice and clean.
Well, there's some very dramatic photographic evidence of this sort of thing. When I was in Michigan, when we were doing the original work on topical retinoids for photoaging, a medical student who was working with me at that time, a guy called Rob Singer, made the observation when he was working with me. He said, I think some of these men we're seeing particularly have an asymmetry of their sun damage, more wrinkles and brown spots on one side of the face than the other. And we thought that this might be more so on the left side of the face, which could be associated with driving and the UVA particularly coming through window glass. So the way to test the hypothesis is that we set up a series of lectures with truck drivers, Teamster Union members in Detroit. And as part of the lecture, we'd do a skin examination afterwards. And sure enough, they had more sun damage on the left side of their face than they did on the right. And the similar study was done in Australia, where they drive on the same side of the roads as the UK, and it was more on the right side. And there's been some very dramatic photographs of this. There's a picture in the New England Journal of Medicine a few years ago of a truck driver who manifested this really quite remarkably. So yes, it's interesting. There's that sun exposure, and particularly UVA does cause a lot of the damage.
Because usually we tend to say UVA is good, UVB is bad. That's not the truth anymore.
No.
So let's come to what to do. So the phenomenon is there. We know a little bit or something about the mechanisms. What can we do to prevent it first, or to treat it when it's there?
Yeah, so I think it's important at this point to sort of try and separate the photoaging that we've just been talking about, where, of course, the obvious answer there is to avoid excessive sun exposure, maybe using sunscreens, with the caveat that, of course, sun is beneficial. We do know the sun has a lot of positive effects on physiology, such as everything from vitamin D production in the skin through to maybe effects on cardiovascular system due to release of nitric oxide, due to release of endorphins as well. So there's a lot of positive things. It's a matter of, like everything in life, doing it in moderation. But so sun exposure, sunscreens were probably the best way of preventing or reducing the signs of photoaging. But the key is what we can do about aging itself. And I do think there are things that can be done. What's happened nowadays, of course, is some very rich men, predominantly men in the world, are getting older, such as Jeff Bezos and Elon Musk. They want to stay young, and they have a lot of money to invest in this area.
Okay.
And so there are literally billions of pounds being invested by high net worth individuals in biotech companies devoted to trying to understand aging. And there is some good work coming out of this. And we know that there are certain things that one can do to help themselves. And we're talking about health span as well as lifespan. Calorie restriction, definitely, in everything from nematodes through to monkeys through to humans, prolongs life. There's no doubt about that.
It's not very popular, but it's effective.
It's effective.
But they say there's a easier approach by intermediate fasting, that you don't have to fast the whole month or so.
Well, no, you're absolutely right. So I'm quite an advocate of that. There's sort of intermittent fasting that could be just fasting on 2 days out of 5, or it could be having a time-based fasting. I think the time-based fasting, which is when one doesn't take on board any carbohydrates or any food, just sort of maybe black coffee or water, but maybe between 16 and 18 hours a day. Now, that's more than calorie restriction, Johannes, because the fasting part of this is when, of course, as you know from your biochemistry, is that the body then stops metabolizing carbohydrate, glycogen, and goes to glycerol. And it breaks down to free fatty acids and then ketone bodies. And ketone bodies are anti-inflammatory, which goes back to what we were talking about earlier with inflammaging. And there's some good evidence now coming from various studies which have shown that the fasting components of that may well be beneficial to prolonging health span, because effects on the immune response, and also on stem cell mobilization. So intermittent fasting has quite a strong following. There's some big studies taking place in the United States now to ascertain the benefits of in intermittent fasting, not just on aging, but on maybe prevention of inflammatory disease.
Well, you mentioned stem cells. So as the source of maybe eternal youth. And some times ago, already rich men got fresh cell therapy or injection of embryonic cells. Now we hear something coming from Japan by the Dr. Yamanaka. What is your opinion to these new approaches regarding stem cells and derivatives?
Well, Professor Yamanaka, of course, won the Nobel Prize for his development of induced pluripotential stem cells and the so-called Yamanaka factors. And there was a study published at the beginning of this year, 2023, which was using a gene-modified mouse, which had incorporated into 3 of these Yamanaka factors. And what was shown, quite remarkably, was that these mice, these genetically modified mice, compared with the wild type, lived about twice as long, and importantly, not just had longevity, but their frailty was less than one would have expected in a mouse half that age. So there may be, obviously there's a lot of work to be done on this, and this was in mice, there may be some opportunity there to really get to the root of what produces a health span.
Well, this sounds very exciting. It would not only be prevention, but maybe even treatment of already aged skin.
It could be. I think the thing is, though, like all of this in life, it's a matter of starting early. Trying to prevent things is going to be more effective than trying to reverse things that have already happened, particularly with the aging process.
Well, I'm a practical man, and all those stem cells and fasting I really don't like. I would like to have a pill. Give me a drug I swallow once a day and makes me live longer. Is there anything pharmacological?
Well, there's a lot of work on this as well, of course. And another big study in the United States that's taken, well, I guess just to back up a little bit. So there's autophagy, which is, of course, as you know, is when a sort of simplistic way of describing it is when the body's sort of cellular system sort of spring cleans every day, in fact, given the opportunity. And there are various things that we can do to stimulate autophagy. 2 of them we've just discussed. Calorie restriction helps, intermittent fasting helps, more sleep also helps. There's a lot of positive things happening whilst we're sleeping, and also moderate exercise. That's not running marathons, but moderate exercise every day also helps the autophagy process. But people are looking now for drugs which actually stimulate autophagy, and there's a sort of whole class of drugs now being developed called senolytics. But a couple in that sort of area, ones which you and I are familiar with. One is metformin, which has been used for many years to treat particularly type 2 diabetes. There's a big study in the United States looking at the effects of metformin on aging and and frailty, and also rapamycin, which has been shown certainly in nematodes and mice to actually have a beneficial effect on prolonging life and prolonging health span. So there's a lot of interest in this area, and mice which have been genetically modified there are senescence produces senescence associated secretory phenotype or senescence associated secretory proteins, and these are detrimental to long life. And so these so-called secretory proteins can be down-regulated or prevented by a number of different approaches, everything from autophagy to drugs such as rapamycin.
The rapamycin might have some side effects.
So yeah, of course.
Maybe it would be good to come up with milder treatments in this direction. Metformin, I think that sounds quite good. Many people take it, and it's good news for them.
Mm-hmm. So there's a big study looking at metformin to see whether that really is beneficial. I have a feeling it might be.
We could talk for hours, but we should spend a couple of minutes on the public health and the health political aspects. So, especially in dermatology, people say, well, this is not a disease, this is just normal, and therefore insurance doesn't have to pay, and it's only cosmetics. So what is your opinion towards treating photoaging and trying to help people?
Well, that's a very good point. And I think that Professor Kottner, who works at the Charité Hospital in Berlin, is taking forward a project on behalf of the International League of Dermatological Societies, which is a systematic review and analysis of the provision of screening and diagnosis of skin disease in the elderly population in the community. So, and as you know, a lot of people, and the elderly people, are in residential homes and nursing homes, and part of their general maintenance or screening does not include skin disease. But a lot of these people, when you ask them what troubles them most, is that they look around the room and they feel that they're sitting amongst a room of old people. They don't like being treated as being old. They don't like looking old. And I think that we need to understand the psychological aspects of being old or looking old in a very youth-orientated society.
Well, but I think it's not only psychology. I like our friend Jean-Hilaire Sora's terminology. He calls it dermatoporosis, an analogy to osteoporosis. Everybody is impressed what a difficult problem and serious osteoporosis, but in the skin they say just skin aging.
You're absolutely right. I mean, it's a very nice analogy, dermatoporosis. I've used that term myself many times. And if you look at someone with aged skin, it is going to have that. It's got that loss of hyaluronic acid, which is something that John Hilaire worked on quite extensively. And the skin is much more fragile. It's much itchier. It heals more slowly. All of those things. And I think and that's something we need to understand. What are the mechanisms at play there, and can we prevent that happening? So, and also I think, skin health is very closely aligned to overall health. And just as an aside, we talked about nonagenarians, Johannes, and there's a study from Leiden where they've been following up, not the nonagenarians themselves, but their offspring, their sons and daughters. And the comparator group are these spouses of those sons and daughters who come from a similar economic class. And what they found, very interestingly, and I'll just talk about what they found in women, but they did a whole, taking photographs of lots of these people and then morphing them together and then getting an expert panel to say how old they were. And the offspring of the nonagenarians look younger than their stated age by about 8 or 9 years, whilst the control cohort look about the age that they say they are. But importantly, for the systemic health, the blood pressure, particularly in women, the systolic blood pressure for the offspring of the nonagenarians who look younger for their age was much lower, at about 120. That's the systolic blood pressure, compared with 150 for the people who look older than their stated age. So there is a correlation, and there's some work done in Japan that shows increased risk of atheroma in people who look older than their stated age.
Well, at the WHO level, I think sometimes one has the feeling that the skin is forgotten. They talk about every disease is serious, but sometimes skin is not taken seriously enough, I think.
Well, you're right, because when the WHO came out with their report on aging, or going through the draft, and Wolfram Sterry, who at that time, as you know, was president of the ILDS back in 2016, he, just before that, actually, he had been a strong advocate for the WHO taking skin disease more seriously, and aging particularly. And in the first draft of that report, skin wasn't even mentioned. Luckily, we managed to get a chapter on skin, which then sort of raised the profile. And you're absolutely right, is that the WHO and others need to understand the importance of skin and skin disease and how that does relate to the aging process.
So there is a lot of work ahead of us, both in research, in the clinical routine, in treating our patients. And one last question. So 5 years from now, how do you see? What are your ideas, your visions? What could come in 5 to 10 years?
Well, I think in 5 to 10 years' time, what I'd like to see would there be a concerted effort on research on skin aging, not the cosmetic side, but on the understanding the mechanisms that drive skin aging, and making research on skin aging as acceptable as other areas. When I came back from Michigan all those years ago, I thought there'd be a lot of people working on skin aging. It's still pretty much the same people doing that work as there were 25 years ago, which is quite remarkable. But the other thing that I think that we'll see in 5 to 10 years' time, Johannes, is that you and I will be looking even younger than we do now.
This sounds good. Professor Griffiths, dear Chris, thank you so much for being with us. I think we have learned a lot in this half hour. Thank you very much.
Thank you. Thank you. I've enjoyed our conversation.
Before you go, a quick favor. If you're a regular listener of our podcast, we would love to hear from you. Your feedback will help us improve the show and develop episodes that you are interested in hearing. To participate in this short survey, simply follow the link in the show notes of this episode. Thank you for your support. It means a lot. We look forward to hearing from you. Until the next episode, take care of your skin.